Hello, my name is Nahum, and I've been involved with Turn to Us in looking at some data in relation to mental health of people on low income during the lockdown.
And my name is Pip Johnson, and I'm the Head of Insight and Impact at Turn to Us. So firstly, thank you for tuning in and listening to us today. And I hope everyone is okay wherever you are in the world at the moment. We are going to talk a little bit today about the experiences of service users at the charity Turn to Us and the impact specifically that coronavirus and lockdown have had on people's mental health and their well-being. As a quick overview, Turn to Us is a national charity who supports people in the face of life-changing events and collaborates to tackle the causes and the symptoms of poverty. What that means in practice is that we do a number of things, including grant making. So each year we give out around £3 million in grants to individuals and to families who are experiencing financial hardship. And since coronavirus, that has increased, and we have responded to the virus by giving out over £2 million in crisis grants to people who have been affected by lockdown. We also give personalised information and support. So we have a number of tools that help people with their finances. Those include a benefits calculator, which lets you check what you're entitled to in terms of welfare benefits, and also a grant search tool and a telephone helpline for people who are not digitally able. And the numbers there just show the typical number of people who will use those services in a given year. And the final thing that we do externally is to champion the rights to social security and to tackle the stigma that exists around experiencing poverty or financial hardship. So most of the insight that is going to come in this talk is coming from our benefits calculator. So I think it's worth just briefly mentioning the demographics of those users because they are not representative of the UK. So we see far more women using the benefits calculator than men. And our demographics on that digital tool are also skewed towards younger users. So our main cohort of users is women between the ages of 25 and 44. And as the final slide before we talk about the insights we're seeing, as an ethical disclaimer, the results that we're showing here are based on data from our digital tools and also on responses to questionnaires that people fill in. Okay, so now if we look at some of the insights that Turn to Us is seeing through lockdown, what we're seeing in our data is a surge in demand for crisis grants and benefits checks. And that happened kind of immediately after lockdown into April, before then returning down to kind of the levels we were used to seeing before lockdown. In terms of the well-being of our users, what has struck me and was quite surprising actually is that, as you would expect, the well-being of people who have just had a life-changing situation or are looking for benefits is very low. It's lower than the UK average. But the impact of coronavirus on that has actually been very minimal. So our users have seen an unchanged level of well-being across this period from before lockdown, whereas the rest of the UK has seen a much bigger impact from COVID. And in terms of the mental health of our users and what's affected that most, What's coming out of the qualitative data we have from surveys is that the main things affecting people, as you would expect, are anxiety because of a loss of income, or anxiety around paying essential bills in their household. And then some secondary kind of anxieties and concerns around either the difficulty with caring responsibilities during lockdown, and also the kind of stresses and strains of remaining at home, which I know many of us will be facing as well. So this just shows, in a very simple picture, the kind of surge we saw in people checking their benefits immediately after lockdown. So typically we see around 30,000 people per week checking their benefit entitlement. And in the middle of March into the kind of middle of April, that shot up to something like over 200,000, going on for 250,000 people in a single week checking what benefits they were entitled to. And then we see that reduce back down as the government brought its support schemes in.
We have also looked at well-being trends, and particularly the areas of happiness and anxiety. What we have observed is that both of them have been key factors to look at during this lockdown. Anxiety, to start with, has been high before the lockdown, and it carries on being at a high level from what we have seen in our surveys. People have been anxious from before the lockdown and even after. When you look at the general UK population, studies independent of Turn to Us, anxiety levels have risen, and during lockdown they actually peaked to a particular level, and over the last few weeks they've kind of stabilized a little bit more. We also looked at happiness as a key trend, and the average happiness levels for people who've tried to use some of the services, like a benefit calculator and other things like that, before lockdown have been at a consistent level, and they haven't changed too much after that. This could be partly because, people have accepted that reality, of being able to look for help in that way. But then the data that Turn to Us has put together shows that the levels of happiness were consistent and dropping slightly, but when we hit lockdown, they actually dropped significantly. And that's a reflection of the levels of happiness in society at the moment. There are concerns that people had when checking their benefit entitlements, and this is between March and July of 2020. So some of the key things include the following. The fact that people would go into crisis mode because of the sudden drop in the levels of income. Some lost jobs, some had changes in the way their jobs were. And bear in mind that this was during the furlough scheme time as well, while it was being developed. There was also stress and uncertainty about how to pay for bills, and how to buy food. And those were genuine concerns that people have had back in March when the lockdown started. There was also the fear of losing homes, and people who rent, being potentially evicted. So those were concerns that they had at the time. And lastly, caring, responsibilities, and self-isolation. A lot of people live on their own. They might not have a family, and that was a genuine concern. Others were in high risk groups, and some were told to shield as well, to self-shield, so they weren't able to see anyone. If we fast forward to July, some concerns still remain high on that list. A key one, as we can see there, is the ability to pay rent and mortgages. That is still a concern. This is despite mortgage holidays being offered in some cases, and funds being provided through the furlough scheme. That is still a concern, just as recently as July. The additional concern about the ability to find a new job during a recession and a competitive market. You will appreciate that when you're looking for a job, if you have a gap in your CV, that becomes a source of concern, because the longer that gap goes, the more tricky, difficult it gets to find work. You would hope, obviously, that is not the case, but that is something that is genuinely a concern for quite a few people. There is also the possibility of a second wave of this pandemic that we've been going through. That is always in the back of people's minds, and that is a concern that could be there as well. Delays to other services, a host of social care and health, and the lack of social contact and exercise. That's back to some of the concerns from March. Those are still key concerns in July that people are worried about. There are, of course, limitations to the data that we've gathered, and some of the things very quickly just to mention there. The survey respondents are self-selecting, and the sample size is relatively small compared to the number of users. So we are almost in a sense relying on people just taking that step to either respond to our surveys or get in touch and understand what we offer as an organization, and off the back of that, we're able to then ask further questions. But there's a whole set of people who may not have reached out to us, or we may not have reached out to them. So we're actually missing that set of the population, and makes our analysis slightly limited because of that. Responses as well, qualitative responses, they are not tracking the same people all the time. The concerns are from different groups of users. Thirdly, it represents the views of just those who are digitally able. We haven't considered those who do not have access to a computer or do not have computer literacy. So there is a percentage of the population that's not being captured here at the moment. And finally, obviously myself and my fellow speaker, we are both male. We are from a history of stable employment and living in two-parent households. So our joint interpretation will be from one view, and it might not necessarily capture a wider view of different kinds of people from us.
Okay, what the future holds is a very big question to be asked at this point in the year, but I think what this has shown me personally, and I think will reaffirm for Turn to Us as well, is just how central well-being and mental health is to our service users, and that even something as dramatic as this pandemic and the lockdown that we've experienced have actually not dramatically affected the levels of well-being that people are experiencing. And it's something we've been thinking about for a while, and so we are starting to kind of place more emphasis on well-being and put mental health and well-being as a more central part of what we're doing, and put a more conscious focus on it. So two examples of how we're doing that at the moment are, we are designing a new version of the benefits calculator, and we're doing that through a co-design process. So we have a panel of 12 fantastic people who have previously used the benefits calculator, and are now helping us to design it in a way that will make it more easy and more effective for people to go through that process of checking their entitlement. We're also looking at smaller pilot initiatives and the potential for us to start doing more things like warm referrals. So that is where we are when someone comes to us with a separate issue that's not about their finances, where we can refer them on to another organisation, another specialist, and give them a proper named person and a proper journey for them to go and get the other support that they need. So one of those may be around things like well-being and mental health, and the stresses and anxieties that people face when they're going through a life-changing event.
Some other areas and ideas for Turn to Us in terms of the future We have recognized that Turn to Us is a relatively small charity, but we are looking at the potential of partnering with other mental health organizations. We're just trying to see how they do certain things. And one of the key things mentioned there is the text-based support services, looking at possibilities of synergies and working together and just trying to see how best we can put our heads together or learn together. As is mentioned in the last point there about benchmarking, looking to see what we have done against what they have done and how best we can learn from each other. Other digital providers will be trying to do something very similar to what we're doing in supporting mental health. And we just want to see how best we can learn from them also. Thank you very much from myself and my colleague Pip. Thank you.